Hi everyone, I am Dr. Anthony Dakpallah. You can call me Tony for short, your friendly radiologist. Today, let's answer one of the most commonly asked questions by patients, which is, Doctor, can I eat or drink before my scan? It sounds simple, but the answer actually depends on which scan you are going to do, and it definitely does matter. Let's start with ultrasound scan. For some ultrasound scans like abdominal and or pelvic ultrasounds, we do ask you to prepare a bit. If you are going to do an abdominal ultrasound, we usually ask you to fast for about 6 hours. And this because food and gas in your stomach can block the view of organs like the liver, the spleen, your kidneys, even your pancreas. And these are basic organs that we usually look at when we are doing an abdominal ultrasound scan. So we need to have clear pictures, and that's why we tell you not to take in food to avoid having bubbles in your tummy. Now, if you are doing a pelvic ultrasound on the other hand, we tell you to take in water. And the reason behind this is that the water fills your bladder, causes your bladder to fill up, and it pushes away the intestine, which contains air, by the way. And so this enables us to see better. It enables us to see the pelvic organs such as your uterus and your ovaries. And so in this case, we tell you to drink a lot more water. So yes, sometimes we want you to eat nothing, and at other times we want you to drink everything. So let's go on to CT scans. For CT scans with contrast, we usually ask you not to eat for a few hours before. It's just to make sure that you don't feel nauseated after the contrast injection. Sometimes patients may come in with a full tummy, and after giving the injections, they begin to feel nauseous. And because they have content in their tummy, they vomit it up, and it interrupts the whole procedure. And so we advise not to take in anything before the scan is done. If it's a CT without contrast, eating lightly is usually fine. And for MRI, it's a bit similar, but some exams still require fasting. So especially MRIs with contrast. But for others, we don't really require that you should fast. So here's the rule of thumb. Always ask when you are booking the scan, and then follow the preparation, the prep instructions you've been given carefully. This really helps us to get good images. And also, don't assume that it is fine to eat, because it might not be. So yes, eating or drinking before a scan does matter depending on the type of scan. And now you know why your radiologist keeps reminding you about fasting or drinking water. If you found this helpful, hit the like button below and share with a friend who is about to get a scan or who is just interested in radiology in general. And don't forget to subscribe so that you can view any upcoming episodes. See you in the next episode, where we'll talk about why you should never wear a metallic object in an MRI scan. It's going to be an interesting topic, and you don't want to miss it. Thank you, and have a good day.